unfortunately, in our society, we have a legacy among the dying where physicians thought that they could treat and treat and treat and maybe a person would recover. And unfortunately, there are times when people are not going to recover and when some physicians are simply not honest with themselves about that and they overtreat, and the family is left with this feeling that the patient really did not have proper care. People were afraid that modern technology would take over their dying process and that they would have that dying process simply dragged out and the results would be catastrophic, that they would simply be kept alive basically against their will and with no hope of recovery. Advanced care directives, or as they are commonly known, living wills, are something that have surfaced in the latter part of the 20th century as an assistance at the end of life. They, like everything in healthcare, have a history, and the history is a little bit checkered. Advanced care directives originated with the euthanasia movements of the 1920s and the 1930s. People in those movements believed that if they could write out a document, they could, at the end of life, when they themselves were no longer conscious or no longer capable of making decisions, have somebody simply end their lives. However, the concept of advanced care directives changed dramatically in the 1970s and the 1980s. During that time, the machinery of modern healthcare began to do dramatic things both to save human lives and in some cases to prolong human lives well beyond the time that they should have been prolonged. The famous case of Karen Ann Quinlan in 1974 set off much of the modern debate in bioethics about end-of-life treatment. Karen Ann Quinlan was a young woman of 20 years of age who, after a party and using probably Valium for her nerves and a combination of alcohol and we don't know what else, slipped into a coma. And when she went into a coma, she was rushed to the hospital, taken to the intensive care unit and put on a ventilator to keep her alive. This machine, of course, doing her breathing for her. After several months, it became rather apparent that Karen Ann would never come out of this coma, that in fact she had slipped into what we call a permanent vegetative state. The parents, recognizing that there was little or no hope for her recovery, asked the physician in charge to remove the ventilator, and he refused on the grounds that if he removed the ventilator, she would die. That would, of course, have been considered murder. But the parents saw this as somehow an intervention that was keeping her alive and not allowing her to die, so they went to court. And after the court case, and many others similar to that, there was a great deal of struggle in North America and throughout the world about how to deal with people at the end of life. One of the solutions that was proposed was the use of living wills or advanced care directives. These directives were seen to be an effort on the part of human beings to take some control over their own health care, so that at the end of life, if they were not conscious or not capable of making a decision, their wishes would be known so that they themselves could determine what their care would be at the end of life.